Today on Corporate Review, join us as we explore innovative technologies, cutting-edge solutions, and timely discussions from leaders across the globe. This is Corporate Review.
Welcome to Corporate Review. I'm Donald Trump Jr. For mobility-challenged individuals and their caregivers, there are two important factors when it comes to their care. It should be safe and handled in a dignified way. Charlie Wallace, President and CEO of Prism Medical USA, joins us today to share his company's solutions that encourage improved care, quality of life, mobility, and how they are helping lower the overall cost of caregiving. Welcome, Charlie.
Thank you.
Charlie, what are some of the issues that mobility-challenged individuals face when it comes to their caregiving and well-being?
Most of the issues are related to accessibility, lifting, handling, and transfer, particularly in a home environment. There are over 5 million people in the United States that are mobility and challenged, and if they can't solve their accessibility, lifting, handling, transfer issues, they're likely going to be put into an institutional environment. Nobody wants to do that. So their biggest problem is staying at home.
So who is Prism Medical, and what are you ultimately doing to alleviate some of these challenges?
Prism Medical is a leading manufacturer of mobility-related products for the institutional environments and home environments. So we design, engineer, manufacture, and distribute all these products and services to the acute care, long-term care, and home care environments.
Let's take a closer look at Prism Medical in this Corporate Review Field Report.
We design and manufacture products here in our St. Louis facility. They're in compliance with ISO guidelines and FDA CSA authority. We employ a number of Six Sigma Black Belt process engineers for internal process improvement and also design engineers for enhanced product redesign. There's two big advantages to being in St. Louis and manufacturing in the United States. First, we have a very complex product that we offer our customers in that we do custom ceiling lifts and custom slings, over 600 varieties of slings, over 200 varieties of motors, all custom configured for the individual in the home or in the hospital. In order to satisfy those customer needs, we shorten our supply chain by going with local providers in the St. Louis area. That enables us to be very cost competitive because we don't have an enormous inventory carrying cost buying from overseas. So we're able to react quickly and cost effectively here in our St. Louis facility with local St. Louis providers.
I imagine there's the obvious challenges for patients themselves, but what about some of the safety concerns of their caregivers?
Well, that's a big concern. That might be the biggest concern we have in healthcare today, which is how do you actually care for people in a low-cost manner and in a preferable manner? And what that means is people want to stay at home, not be institutionalized. And the cost of keeping people at home is about 1/3 less expensive aggregately, Don, than having them in an institution, and by far it's more preferable.
Lastly, Charlie, what does the future hold for Prism Medical?
Well, the future is very bright. Our company will be known, I'm certain someday, as the company that helps people keep their loved ones at home when they want to, not being institutionalized. And secondly, a company that will use its products and services to help institutional environments in the healthcare industry lower their costs, become more efficient, increase the quality of care to their patients.
Well, Charlie, it sounds like not only are you providing great solutions and services, but really also a great resource for a much needed thing in many families' lives today. Thanks for joining us here today.
Thanks for having me.